after weeks of severe floods in Nigeria's northeast, the government's warned that 11 more states may be at risk following the release of water from a dam in neighbouring Cameroon. The deluges that have hit the country this month alone have impacted hundreds of thousands of people, and it comes as the whole of West Africa experiences some of the heaviest flooding it's seen in decades. Now, the WHO, the World Health Organization's warned that one side effect of climate change-induced flooding is a rise in snake bites. They kill tens of thousands of people every year. Sub-Saharan Africa has around 314,000 snakebite cases a year and around 15,000 deaths, but faces a critical shortage of the treatments needed to bring those numbers down. Now, the World Health Organization's ramping up the availability of antivenoms for the worst affected Sub-Saharan African regions. And for more on this, I'm joined now by David Williams, who's a specialist on snake bites and snakes from the WHO. David, thanks so much for making the time to speak to us. First of all, can you just elaborate a bit more about the scale of the problem and what the WHO's focus is in Africa when it comes to improving access to antivenom?
Sure. So snake bites are a really big problem in Sub-Saharan Africa. Every year there's some 200 to 315,000 people are estimated to be bitten by venomous snakes, and somewhere between 15 and 20,000 of them die, and about 3 times more than that are left permanently disabled. Now, right at the moment, with the events that are happening in Nigeria, it's happening in what we call the carpet viper belt. These are a small species of viper that are very, very common in northern and northeastern Nigeria, in neighbouring Cameroon and Chad and Niger. And with all this water on the ground, just as people have got to go somewhere, snakes do too. So this brings them into direct conflict with each other. And our colleagues who are working in Nigeria are reporting that there are hundreds of more cases of snake bites. And in fact, there's been a chronic shortage of antivenom, such that the government has just had to source an extra couple of thousand vials on an emergency basis. Now, unfortunately, this is something that happens all too often. So WHO really has recognised the need to try and look at how we can make antivenom supply more sustainable and ensure that the products that people have are safe and effective, and they're in the right places to be used when needed.
And so how are you doing that? I mean, and is what you're trying to address some of those issues that were made clear during the pandemic about the cost of Africa's difficulty in providing its own or producing its own medical supplies?
So exactly. I mean, it's really important that countries have their own capacity. Unfortunately, with the production of things like antivenoms, we find that many parts of the world struggle. And if you were going to build a new antivenom production facility today, anywhere in the world, it might take 7 to 10 years to get it up and fully running. And of course, we can't have people continue to suffer in that time frame. So we have to find alternatives. We're working with existing manufacturers to try and improve the quality and the safety profiles of the products that they have, and also so that they can increase their production. We've developed a number of different products to help research teams, antivenom manufacturers and regulators understand the products much better and be able to, in future, design and develop new products that will better meet Africa's needs. And of course, we're talking to governments at the moment about the possibility of pooled procurement for antivenoms. Governments banding together, working with WHO to secure supplies of products that we've already evaluated and found to be safe and effective,
David?
and making sure that they're distributed to the right places.